Hi, I'm Dr. Anna Baranowsky, and I'm really happy to be here with Dr. Christine Hibbert. And thank you so much for joining us, Christine.
Oh, it's a pleasure to be here. Thank you for having me.
Christine, you are really involved in exercise and the impact of exercise on mental health. And you've written this great book that I've been enjoying myself, and the 8 Keys to Mental Health Through Exercise. And I just love this because it's something that when I see it in my clients when they take on exercise, it makes such a pivotal difference. But you wrote a few very, very interesting things in your book. And one of the things that I want to start with is really, like, you describe yourself as a specialist in PTSD, and really that's the bulk of the work that I do as well with clients that I see personally, and, you know, the people that I reach out to through my training and the work that I do with my videos. But, you know, you made a mention of being a specialist who focuses on PTSD, but you have your own trauma history, and I think you really learned about exercise and how there can be some pretty dramatic things that happen when you start to exercise trying to heal. So can you talk about that to start with?
Right. So, I mean, I think the first experience I had with trying to heal through exercise was when I had my first baby, and I suffered from postpartum depression, and I really didn't find the support that I needed at the time. It was almost 20 years ago when this was happening, and there just wasn't as much information or resources. But I started just going on walks around the block with the baby, and I started to realize not only was I probably started doing it because I wanted to lose the baby weight, but really what I noticed was how it made me feel, and that it gave me better energy. It helped me overcome those feelings of depression and anxiety and worry that I had. And so I developed the habit then and kind of carried it with me. And in my book, This Is How We Grow, actually talks about the most traumatic experience was in 2007, we actually inherited our 2 nephews when my brother-in-law and sister both died within 2 months of each other. And we went from 3 to 6 kids practically overnight because I was pregnant. We inherited our nephews. I gave birth, and all of a sudden I was a mom of 6. Wow. So the whole family was going through trauma. And again, exercise was, you know, in addition to therapy and family therapy and all kinds of other things, was such an important tool. And I would just put the baby in a carrier and go for a walk, or put the baby in a little bouncy seat and get on the treadmill in my house and just work through those feelings of grief and trauma and distress that I was going through, and help my kids do the same by playing with them and getting them active as well.
Now, you mentioned something very interesting about how, in fact, exercise can create anxiety. And I think that's a big barrier for people who are trying to start to get healthy and exercise. I understand, you know, what you're saying about how this really, really helped you. And I can't imagine what a tough time it must have been. You're like a hero to get through something like that and show up for all those people in such a significant way. But I know I hear this from my clients that sometimes they get anxious when they start exercising. So what's that about?
Well, yeah, because you think about it, exercise mimics those feelings of anxiety. It does get your heart rate up, and it does make your blood pump, and that's what anxiety does for us as well. So a lot of times those who suffer from anxiety might feel like exercise is either provoking anxiety response, or it feels too much like that anxiety or panic that they're going through. So that's why it can be a challenge, but it can be overcome because not all forms of exercise have to be that heavy breathing, cardiovascular type of exercise. And the point really, my main message that I want to give to people as I talk about this book and this topic is that we don't have to define exercise in just one way. And it doesn't have to mean that you're jogging or you're going swimming or anything. It means that you are moving, that you're trying to be active and move your body in some way. And that can be a very relaxing experience depending on the type of exercise you do, and also what you're telling yourself about it and how you kind of walk yourself through the exercise and how much pressure you are or aren't putting on yourself. You know, if we're just thinking, I'm just moving my body for mental health, that's different than I have to exercise 45 minutes or else blah, 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 right?
Right. It's a lot of pressure. I know people have these big goals and they kind of carry the burden of it and the expectation. But, you know, what if somebody has kind of done those early steps and they're feeling stronger, but they feel like they do want to increase their kind of aerobic fitness, and they're feeling these panicky feelings, because I hear that so much. So what do they do
Right.
to face that?
Well, one thing I'm big about, and I write about this in the book, is first of all tackling the thoughts and the beliefs behind what we're doing in exercise. So again, it's easy for me to sit here and say, don't be hard on yourself, but really that takes a lot of effort to be able to hear what you're thinking. And I propose using cognitive behavioral therapy techniques like a thought record and trying to hear what you're saying about exercise and when you are putting pressure and how those thoughts relate to that feeling of anxiety. And so that's a first step. And then a second step is my new favorite word, which is gentleness, to be gentle with yourself and to understand that it's just as good to walk very gently around the block. That's better than not doing it because you feel like you have to run or to jog, and you don't. I mean, gentle, normal, everyday walking is a wonderful exercise, and you can get those same benefits from just doing that. So I think it's that combination of, tackling those thoughts and beliefs and feelings that you have, and then also, and that prepares you then to hopefully be more gentle with yourself when you're going and trying to exercise, and to take it in very small steps. I mean, I propose go walk to the mailbox and back. And then maybe the next week you walk down the street and back, and, take it very slowly, and also pick activities that you actually want to do. You don't have to do what your neighbor does or your spouse does or whomever. Pick something that you actually might be interested in.
Now, but how does the mind and body actually heal with exercise? What happens?
There's several different hypotheses, but one of the most popular is that exercise works almost like a medicine in the sense that it increases the neurotransmitters in the brain. So we all know that exercise releases endorphins, which make us feel good, those chemicals that feel good, that runner's high that you have after you exercise, and that's one reason why, we immediately can get that benefit right there. But also, research shows that the neurotransmitters like serotonin that make us feel healthy and well, those are also increased when we exercise, and especially with cardiovascular exercise, and it doesn't have to be intense, even mild cardiovascular exercise. So that's one hypothesis.
I know that when people actually have those benefits, those physical and also neurological benefits, it can help somebody turn the corner. You change your brain chemistry, that's a pretty powerful thing. But it also does something in your muscles, your joints, your ligaments, like it just makes your body feel better overall, and that's pretty awesome.
It does, and exercise not only can improve your, like you say, improve your body. You feel stronger, you feel healthier, you feel better about yourself. It's been shown through research to improve self-esteem, to improve family relationships. So when you're right, when you're doing this exercise and you're seeing those benefits, then you just want to keep doing it. And again, I always say most people start exercising because they want a physical payoff. They want to lose weight or they want to get in shape. But most people actually stick with it because of the mental health benefits and payoff and how good it makes you feel, really.
Yeah, it does make you feel amazing. So any other things that you can say in terms of getting somebody to overcome roadblocks to exercise, just to get started? What are your top 2 typical roadblocks?
I was going to say some of the most common, obviously, is I don't have time.
Yeah.
That's a biggie. So if you feel like you don't have time, well, I say that might be your quote unquote reason, but really it's an excuse that we can all have time, and you don't have to spend, again, an hour a day doing this. Even 10 minutes to start is great. And you don't have to do it every single day. Even 3 days a week to start is great. So even fitting it in while you're doing something else, taking the stairs at work, or if you're watching a television program, get up on the commercial breaks and make yourself march or something, or walk around the house or run the stairs in your house. There are ways to fit it in so that the time thing, that's an excuse. And another one is that, I'm too tired. I'm just too tired. And it's true. We all can relate to that. We're too tired, but
like you said before, once you start doing this, you start to feel that energy. And really one of the best things we can do when we're tired is to go for just a gentle walk or do something very gentle to move our body, because it gives you that energy that you need. And one thing that I learned a long time ago is that when we're in a bad mood, it's really because we don't have enough energy to meet whatever task we're trying to face. So just getting out and moving your body in some kind of gentle, easy way can give you that energy. And if you can just remind yourself, remember and tell yourself, then hopefully you can next time remember how great you felt afterward. And again, make yourself keep getting over those humps. But yeah, there are a lot of roadblocks.
Yep. I want to thank you so much for talking to me about your book. And I want to just recap what we've covered today. First of all, Christine Hibbert is the author of 8 Keys to Mental Health. It is an excellent book. It's got great suggestions in it and tools and tips and tricks and all sorts of things to help you. You can use exercise to make a huge shift in your life. And your story, Christine, is such an amazing example of that, like what courage it takes and how you used exercise to just make every day a little bit more manageable, that you can actually find ways to challenge your own roadblocks to exercise, and that exercise can actually help you heal by changing your brain. So that's pretty powerful stuff. And I just want to thank you so much for sharing this, sharing your work, and also sharing your personal story as well. So thank you so very much.
Oh, my pleasure. And if anybody wants any more information, they can visit my website at drchristinahibbert.com. Some free resources on what we've been talking about today. Thanks so much for having me.
Oh, that's excellent. Thank you. For more Ask Dr. Anna videos and information about post-traumatic growth and recovery, subscribe and like our YouTube videos at What is PTSD, or join us at previous video episodes in our playlist Ask Dr. Anna from the Traumatology Institute team.